Ola and our daughter Larin. We are from Syria and resident in Saudi Arabia, Al Khobar. Last July 2019, Larin suffered little abdomen pain, and we visited the doctor there to do some tests, and we found that she's fighting cancer. Her cancer, neuroblastoma, was in a serious condition. We started the chemotherapies there, 6 or 7 cycles. Then we have to do the BMT procedure, and BMT is not available in Syria. So the doctor in Saudi Arabia advised us to get contact with Dr. KATEWA. We contacted him and we prepared for our visas. We came here last December. Dr. KATEWA, he explained to us how the procedure will go on and what's the time frame for the procedure to be completed. We started the examinations and everything here in the hospital step by step. The procedure is not like one shot you can do this procedure. It's very hard, it's very complicated, and Dr. KATEWA really, he was the best person to take care about this procedure.
Larin is a 2-year-old girl, and she is beautiful, full of life. But when she came to us, the family was very, very concerned because Larin had a cancer which is very, very common in this age group, and the name of that cancer was high-risk neuroblastoma. So neuroblastoma, based on the age, the type of biology of the disease, and whether it's metastatic, whether it has spread or not, we can categorize it into the low grade, the intermediate, and the high risk. So she was unfortunately high risk. So for high risk, one of the treatment which needs to be done is autologous bone marrow transplant. Autologous bone marrow transplant means we will give Larin high dose chemotherapy, but that chemotherapy along with cancer will also kill the bone marrow of Larin. We give the chemotherapy, we kill the cancer, but in the process the bone marrow is also killed. So whatever we have collected and frozen, we give them back. It's a very, very difficult treatment. It's, in fact, one of the most difficult treatment in the medical science, that is the bone marrow transplant. But the good news is that once, because the cells are of the patient's herself, so once they engraft means they start working, very quickly the recovery happens and everything gets under control.
Now, just recently, 2 days before, Larin improved, Larin condition improved after the BMT procedure. Yes. It was very difficult time. It was very difficult time, but we believe in God, and we know that God will help us to to be strong enough to help Larine become in a good condition. And this is what we are doing our best to just to improve, to make sure that Larine condition will improve and will be treated, the hair cancer will be treated in the best way.